The agenda this week looked at the possibilities ahead in 2023 when it comes to global affairs, when it comes to healthcare reform, and how nurses can make all the difference when one is ailing. The agenda's week in review begins with Anand Giridharadas on whether the art of persuasion can save American democracy.
Progress is a process, as Congresswoman Alexandria Ocasio-Cortez, who I write about in the book, says. Progress is a process. And that group of 60 in the middle, it can move. It is a group of people who can be toggled into very right-wing frames and can be toggled into very progressive frames, depending on the atmosphere, what inflation is, whether people feel things are abundant or scarce, growth is high or low, whether their town feels like it's changing in a way that destabilizes them or stable, whether a leader is charismatic or not, whether they feel like the system broadly serves them or doesn't. These things affect that 60%. And I wrote the book because I wanted people to recommit to the idea of persuasion and seek to woo that 60% and not simply seek to circle the wagons and kind of build and hold their own tiny tribe.
There's a massive echo chamber, though, and ecosystem in the United States right now. We have it to a lesser extent here, but it's certainly huge where you're from, that just is so invested in the status quo. It's from cable channels to political leaders to newspaper to everything.
Social media.
Social media, of course. They want people in their respective corners, and they don't want people to be able to persuade each other. Who wins if that status quo persists?
I mean, I wrote the book because I want, in a way, to illustrate exactly what you said, that there are very powerful people who want you to live in a kind of unthinking, reflexive tribe and not to do what democracies depend on, which is think for yourself and try to talk to people about the world you want. And I think it's important to defy those people who don't want you to think for yourself. And one of the things, that I really learned from writing about the activists and politicians, scientists, and particularly organizers, political organizers that I write about in the book, is that their mental model of the voter is very different from most people, certainly than what I went in with, which is they view people as fundamentally conflicted rather than fundamentally monolithic. People as being, as Beyonce says in her new album, contradicted, right? Beyonce says, I'm contradicted.
This may be the first time Beyonce was quoted on this program.
Wow,
in a political
I'm glad
discussion.
we rectified that.
Well done,
yeah.
well done.
People are contradicted, right? And so, and I will tell you, just speaking personally, the reason some of these characters in the book were a revelation for me, in the Trump era in the United States, my mental model of people on the far side of me politically is not that they have a lot going on. It's that, they're monoliths of what is, frankly, an increasingly authoritarian, even fascistic movement. And that's sort of the single story I have in my mind for them. Well, a lot of the people I'm writing about will remind you that people may love fascism and they may also have married a black woman they met in high school who they love. And they may also have an undocumented coworker who's amazing and think that there should be no undocumented people let into the country.
So it's
and
complicated.
People are complicated. And the resource that you have when you're trying to persuade or build bigger coalitions for multiracial democracy is to try to play up some of those B-sides that people have against that big thing. You can't replace what is in someone's head with the microchip of your opinion, right? If you've been married, does not work. However, you can try to play up sources of dissonance within them that maybe have not been fully activated. That is what these persuaders do, and it works. It works more often than I think we'd think.
Let's do an excerpt from the book. Sheldon, if you would, let's bring this graphic up. The stakes of this writing off were high. Some of the most dangerous and anti-democratic movements of our time had managed, in spite of those features, to make their causes appear welcoming and make newcomers feel at home, whereas some of the most righteous, inclusive, and just movements gave many the feeling of being inaccessible, intractable, and alienating. It seems to me you think the right is very much better at persuading people of the rightness of their cause and bringing people into their fold than the progressive side of the spectrum is. Is that fair to say?
Yeah. By the way, that paragraph is the last paragraph I added to the book. I added it right after I'd finished it, so it's interesting. It was very important to me. I'm going to try an analogy on you, and you'll figure out the Canada analog of this. I sometimes think about this as the New York-Kansas problem, right? New York City versus the state of Kansas. New York City on a formal level, what is the laws, what are the rules? And it's the most inclusive place in the United States. The actual laws, the substance, the structures of New York City. But the vibe New York gives to a lot of people is a little hard to get into, a little complicated, you know, just like you have to know things. It's hard to get into restaurants, hard to get into clubs. New York can give a vibe of feeling inaccessible, even though formally it is one of the most inclusive, you know. And Kansas is the opposite. You go there, everybody's so nice, smiling. You look at the laws on the books, you're living in the 18th century in many ways, right? Mm-hmm. I think in many ways the progressive left sometimes has a problem of being formally committed to an agenda that is, you know, the most inclusive agenda in human history if you look at it on paper, but gives off a vibe of being a hard-to-access movement. If you don't know the right terms, if you don't understand the pronouns thing, if you were kind of socialized as a man 40 years ago, you're not a predator, but you're just socialized in a different time.
We're going to shame you.
You can't quite get in. And the far right in the United States is the opposite. It is formally committed to one of the most exclusionary programs in modern American history. But if you look at something like the Trump rally, the vibe is come as you are, no judgment, get in here. And I think we have to reverse that. I think we need to align the formal commitment to inclusion in the progressive movement with a kind of vibe that is just open and easy and lots of on-ramps.
Well, if there was one thing, Lise, that shook democracies out of their complacency, as Jennifer just put it, it surely would have been Russia's invasion of Ukraine. And I want to pick up our story with you on that because you spent so much of the past year in Ukraine covering that story. I don't want to ask you about battlefield strategy at the moment. I want you to sort of give us, given the time you spent there, your understanding now of what the average Ukrainian family has been experiencing over the past year.
Well, I think when it comes to Ukraine now, we shouldn't use words like average or normal because everything has been turned upside down and inside out in Ukraine. Ukraine is a profoundly different country now. The past is a different country. I think the war in Ukraine, Russia's invasion of Ukraine, even to the last days before, both Ian and I were at the Munich Security Conference. And still there, they were hoping against hope that the invasion wouldn't happen with just days to go. But once it did happen, I think what we've seen unfolding on the battlefield is an upending of we overestimated Russia's military strength and strategy. We underestimated Ukrainian strategy and strength. And when you look at the Ukrainians now, it has taught us a lot about war as well and reminded us that wars are always about metal and metal, the metal of the tanks, what is a steady flow of arms and ammunition coming from the West, including from Canada, but also the metal, the spirit of the people. And I have to say, I was there most recently in November where the effect of Russia's attacks on the energy grid were biting with power cuts and freezing basements where people had to retreat because of the strikes. And not a single person was grumbling, and not a single person in all of the days I've spent in Ukraine over the last year, I've not met a single Ukrainian who doesn't believe that Ukraine can and will win this war.
Ian, how would you explain that mettle, M-E-T-T-L-E, of the Ukrainian people?
44 million people invaded. Incredible courage, charisma, and leadership from the president and from the government as a whole. And in relatively quick order, the fact that NATO really did band together and provide enormous support. The Europeans have now, through 9 rounds of sanctions, 27 countries have unanimously voted in favor of those sanctions. The United States, together particularly with Poland and the United Kingdom, have provided an enormous amount of military support for the Ukrainians. So they're not standing alone, even if it might have felt that way in the early days and weeks of the war. It's been extraordinary to watch. And as I said, unfortunately, the downside here, I did say permanent, the end of the peace dividend. There's no way back for Putin. Having made this immense misjudgment, Ukraine is now militarily incredibly capable. You can't get that genie back in the bottle. The Ukrainians wouldn't allow it. NATO is expanding. You're not going to turn that away. The Germans, even the Japanese, who also share a border with Russia, are now going to be spending 2% of GDP on defense. And the pipelines that used to bring gas to Europe, that's over. Nord Stream 1 and 2, of course, have been sabotaged. It's going to take years and years to rebuild those pipelines so the Russians can bring gas someplace else. This is a very serious problem for Vladimir Putin, who has now become the leader of the most powerful rogue state, frankly, in history.
Having said that, Chevaloy, I wonder how discouraged we ought to be by the fact that the so-called global South has not responded in a similar fashion at all. In fact, many of them have, I guess the equivalent would be they've pleaded the fifth on all of this and said, not our affair, we're not interested. What should we take from that?
I think what we're seeing is the democratic world is, first of all, grappling with the concept of a two-front challenge. One with Russia's invasion of Ukraine, and the second with the consolidation of authoritarianism in Xi Jinping's China. And for the global South, the developing world, emerging economies, a critical question for them is how do they improve their quality of life? And with the center of gravity of global growth moving across the Indo-Pacific region, these are countries looking to modernize infrastructure, develop long-term energy supply, have the kind of partnerships that get the job done for yearning populations. And so until the Western world, the democratic world, prepares the military and economic arrangements that speaks to that self-interest, I think that they will continue to look at the Russian invasion of Ukraine as Europe's war and not their own, when in fact the reality is that much of what Russia is trying to accomplish in Ukraine is underpinned by China's finances.
Jennifer, can I get you on that as well? How discouraged should we be by the fact that huge important countries such as India, or frankly, almost all of Africa, seem quite ambivalent to this whole thing?
I think it was a year in which the global South's position on Ukraine was very discouraging and dismaying for a lot of Western countries. I would add to the list of what you just mentioned, South Africa. But, we need to dig a lot deeper into the reasons for their ambivalence and, in some cases, real disappointment with the West. I mean, in some cases, it is about trade, as Chevaloy mentioned. In some cases, it's about the help that they receive from the Wagner Group, the Russian-backed mercenaries. And in some cases, it's a result of historic ties, as it was with South Africa and the Soviet Union's support for apartheid. But they fundamentally see a lot of hypocrisy in the West. The claim that, Russia's invasion of Ukraine was the biggest threat to the post-war order, it doesn't look that way in a lot of countries in the global South. While the Ukrainian war was waging, there was also a devastating conflict in Ethiopia that many did not, pay attention to. So I think this bigger picture is one that we really need to understand in more detail because each country has their own reasons.
Self-reporting, 2/3 of Ontario physicians are tired, many of them on the verge of burnout. So they just don't have the capacity. You have this, some 20 million services that have not been provided. Those patients are now showing up in primary care with significant comorbidity, with complex disease. Physicians are working about 10% more now than they did pre-pandemic. So you have that challenge of oversight and mentoring to help integrate some of these folks into the Ontario healthcare system. But I can tell you the Ontario government, the college, and the OMA is committed to supporting that.
Can I comment on the healthcare human resources issue? We are a chronically exhausted healthcare workforce. And we've gotten used to that. We actually have gotten kind of addicted to it. We have come to expect that people work overtime. We've come to expect that hospitals, the part that I know best, operate at or above capacity. It's very normal for us to say we're operating at 100% capacity or more. We expect our nurses to work overtime. We actually don't have a workforce built that people can work a 37.5-hour week, which is what you would kind of expect we would have. So we are making these very important jobs extremely hard to do, and we're making them less and less attractive. So as much as it's super important to bring in the foreign trained professionals across the board, including the physician group, and there's lots to be done, we really need to work on retaining the existing expertise we have in healthcare. These very specialized providers that, in our organizations like Ronnie's and my own, we need to create quality of work and life that is going to be sustainable. And that includes compensation that is a living wage for people. And it includes what we expect of them in terms of their day-to-day work.
I was going to sort of come to you for sort of the human resources perspective, because off the top, they talked about sort of, the low number of hospital beds per 1,000 of residents. It has been an issue here in this province for a very long time. But when you have this burnout, how do you square that?
Well, this is the issue, right? I mean, we have prided ourselves in Ontario for our efficiency. But the flip side of efficiency is that you have this capacity issue that's been growing literally over decades. And now, because of the pandemic, we have seen it really rise to crisis proportions. You also have, we haven't had the ebbs and flows we usually have, so people haven't gotten a break. Summers usually get a little bit quieter, less viral disease, et cetera. That hasn't happened. It's been flat out. And then, of course, in children's healthcare, this fall has been extraordinary. So what we see in terms of burnout, we see exactly what Alan described. What people want is to do the right thing for their patients. When I talk to members of my team, as I do all the time, what I hear is their burnout, their sense of exhaustion is because they know what their patients need and they know they can't get there. They can't do what it takes. And that is, that's fundamentally at odds with the values people bring into these professions. When people go to medical school, they become physiotherapists or nurses. It's because of that kind of impact they want to make on people's lives. And so, part of this does come down to funding. It comes down to how we compensate people and making sure that those bedside nursing jobs are incredibly attractive jobs. Nurses can do lots of things. They're very, very talented professionals. They can work in public health. They can work for organizations like yours, Alan. They can work in government. We've got to make sure bedside nursing stays a really attractive job because it's a hard job. That's just one example, but across the board, we need to keep these jobs attractive. We need to retain the workforce we have. We won't be able to recruit our way out of this if we continue to lose people.
Ronnie, I'm going to get your take on this as well.
Yeah, so thank you. I want to emphasize that the issue that Alan referred to in regard to physicians is really applicable to the entire healthcare force.
Yeah.
And when we are talking about retaining currently existing individuals within the system, these are the people who are not only providing this extraordinary care, but who are going to train the next generation. It's wonderful that we have been able to recruit a lot of new healthcare professionals into our systems and hospitals or other parts of the system, but we need the experienced people who are currently working to educate them, so we will have an ever-growing health human resource force that is actually able to provide this high quality of care. So the issue of burnout is universally applicable, and retainment has become as much, if not maybe an even slightly more important issue than recruiting, in order to make sure that the expertise that's currently existing can stay with the system.
I'm actually going to bring in Cynthia Davis out of Corner Brook, Newfoundland. She is the president and CEO of Lake Ridge Health in Durham Region. Thank you so much for joining us in this conversation.
Thank you for having me.
All right, we've talked a little bit about sort of where we're at in terms of the healthcare system and what we've dealt with, and we've talked about sort of a human resourcing concerns. But I want to get your take on how has Lake Ridge Health been handling delayed surgeries and procedures over the last year?
Well, like other organizations throughout Ontario and really throughout the country, when we have been asked to pivot and to change some of our delivery in order to meet the demands that were changing, we certainly did that. And one of the things that we did were we switched some of our surgical procedures for sure to outpatients. We prioritized the ones that needed to be done. And then unfortunately, we also saw some delays. What I can say is that for the past year, we have rapidly been on a recovery plan with our surgical procedures.
In mid-December, your mom spent over 84 hours in a hospital hallway after admission. Here's that photo that you granted us permission to share. She's laying in a hospital bed and she looks like she's in pain. To her left, there's a small table holding a couple of styrofoam cups, milk cartons, a diaper, a roll of tape. What we don't see really is a call bell, a code blue button, or any sort of oxygen masks. We do see sort of a makeshift privacy screen there, but that's a very long time to spend in a hospital hallway. How did the nurses at the hospital support you and your mother through that experience?
Well, you described the situation extremely well. That is exactly where she was, in a hospital hallway, a makeshift part of the emergency ward in the hospital. The nurses that worked in all of the areas that we were in when she was hospitalized were the people who gave us information, the people that, if she would call, because as you said, no call bell, no ability to call for someone, and the nurses they're busy, they're out helping other patients as well. But they were there, they responded, they talked to her, they explained what was going on. They were as kind and caring as they could possibly be. And they also were respectful of her privacy, as you could see the makeshift screens to help cover her when she did need personal care.
I do want to ask, when you got to the hospital and you realized that you're not getting a room, this is where you're going to be. How did you feel the nurses took that? Like, did they feel like this is the best that we can do in this situation, or did it seem like their hands were tied?
I think when she first got to hospital, she went by ambulance. I didn't realize when I arrived that it would be it turned out to be more like 104 hours that she was in a hallway, although having been admitted almost immediately to the hospital. The nurses were the ones who explained the situation. They were the ones who again, kindly and gently said, this is our situation. This is the reality of what we are dealing with right now. And they explained it to us in such a way and said that the most common stay in the emergency hallway beds was 3 to 4 days at that point in time. Now, when she was in, it was just constantly busy, a constant stream of people coming into emergency. At one point, she was very close to where the ambulance bays arrive, and paramedics, patients coming and going all the time. The nurses, again, were the ones with the knowledge. They were the ones that were able to explain, here's the situation. She's here now. She is probably going to be moved. And they were very clear, to another hallway bed.
Oh, wow.
And she was moved at 3 o'clock in the morning to a quieter hallway, so a hallway where at least they could dim the lights.
Okay. Stephen, I'm going to come to you. How have nurses contributed to your overall experience navigating the healthcare system? From what I hear from Janet's sort of experience, they were awesome. They sort of, have sort of a tough position to be in, not only providing care, but also navigating sort of the obstacles. What's your experience been like sort of navigating the healthcare system with nurses?
I think that the thing that I take away most from my experience is that calm compassion that they have. They're run off their feet. They got, one case I had, there was 10 or 12 of us in the ER. I was sitting in a wheelchair for 6 hours or 5 hours. Wow. But they all came by and they all said something to me. They all said, hi, how are you? What can we do? Would you like some water? Would you, what is that? And they laughed when we made jokes, and thankfully I had a book so I could sit and deal with it. But that's what I would think, is that compassion that you felt. That was the weird part, is because these people are run off their feet. I would have probably killed somebody halfway through it. But they were just very, very professional. You could sense that they were frustrated. And you can sense that they knew exactly what they were doing, why they were doing it, and how they were doing it. I was impressed.
Stephen, are there any specific conversations or experiences that you've had with nurses over the last year or 2 years that really stand out to you?
well, I think the funniest one was when finally the nurse had come up and say, your room is almost ready. We're going to put you in our emergency waiting area. It's discharge area. And she kept on coming back and saying, we're just getting it clean. We're just getting it clean. And so I said, you don't have to paint it. Don't worry about it. And started to giggle and just looked at me, shook her head and walked away. And that was good. The second one was when I was in the Hamilton General getting, prepped for surgery. The doctor said, what we're going to do? And I said, yes. I said, you're going to take an Eldon wood burning kit, stick it into me, and cauterize some misfiring parts of my heart. And I just said, just as long as you don't carve your initials in it. And then started to laugh. And so I'm lying on this table with, $4 million worth of hardware around me, and everybody's laughing. And 3 minutes later, I was asleep.
That's just some of what we've covered this week. You can find more, including the full conversations, on our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.